Well, Lenny, the best way to answer that question is just compare where we were back then to where we are right now, what the good news is, and then the sobering news, and then the challenges we have. Just a few days ago was World AIDS Day. That was the 30th World AIDS Day. And I can remember very clearly back in 1988, when we commemorated the first World AIDS Day, we had very few tools in the medical scientific sense to combat this in treatment or medically related treatments. And it was really a very, very dark time. What has happened over the years is that we've now developed therapeutic capabilities as well as prevention. And we've linked prevention and treatment in a way that if you fast forward 30 years from '88 to now, we can say without hyperbole that we have the tools, if implemented the way they could be implemented, to theoretically essentially end the epidemic as we know it now. That's the good news. That's the breathtaking scientific news. The problem is we have an implementation gap. We have not yet done that. And the implementation gap is huge. It's huge in this country and variably huge in other countries that you'll hear about from Ambassador Birx. So the challenge is in front of us. It's kind of, we celebrate what we've done, but we have to be actually sobered by what we can do and are not yet doing.
If we were here 10 years from now, and I was asking you the same question, where do you think we would be?
Well, you know, where we would be or where I hope we would be. I mean, that's really important.
Tell us both.
Okay, where I hope we would be is that we would have such a successful implementation of identifying the people who are infected, getting them on therapy, getting their viral load to below detectable levels so that they cannot infect anyone else, getting the people at high risk on pre-exposure prophylaxis, and implementing in an aggressive way. Also, 10 years from now, I would hope that we would have at least a moderately effective vaccine. And that's something we're working very, very aggressively on right now. If we do that and combine even a 50 to 60% effective vaccine with the implementation of the scientific tools we have, that could be the nail in the coffin of HIV. It really could be. That's my hope. Whether it will happen, it depends on the political, economic, financial resources commitment of the entire world to get mobilized and do that. It's not going to happen spontaneously. That's the problem. Because people think we're doing so well, just stay on course. With an infectious disease, there's no such a thing as staying on course. You either suppress it or it comes back.